gentleman right here, and then we'll go to the back.
I actually have a two-part question for you, if you would, please. Number one is an official sworn to uphold the Constitution of the United States. I would like you to cite where in the Constitution says the federal government is responsible for these types of actions. And number two, assuming you can successfully do that, please address some of the more thorny issues that have arisen with this bill. You did a very eloquent job of explaining to us some of the costs and other issues that have been on people's minds. But what about things like end-of-life counseling by government officials? The need to go to hospice on government officials' orders.
Great, I'm happy to answer those. So where do you live?
Germantown, Maryland.
Excellent, thanks. Listen, so the question was about some of the quote-unquote thornier issues around health care, and first about the Constitution. Well, let me just say, I think that there are some of us who actually disagree about whether we have responsibilities that are inherent in our understanding of the Constitution or whether they're spelled out in the actual words of the Constitution. I happen to be one of those who believes that there are responsibilities that government has to its citizenry that are not spelled out in the single language words of each word of the Constitution, but that they are government responsibilities nonetheless. And so I also believe I'm going to be respectful that you asked the question, and I'm going to appreciate that you're respectful of me answering the question. I also believe that as one neighbor to another, that there are also responsibilities that we share. And the role of the government is to share some of that with its citizenry. And I think that on the question of health care, as I described before, had it not been for the fact that many of you shared the responsibility for my ending up in the emergency room at Prince George's Hospital, then I might not have received quality, affordable health care. And so I think that there are a lot, we can disagree about those things, but I just don't happen to agree on that one. Now, as to the question of some of these thornier issues, I'll just tell you from my own experience. My father died 20 years. He had had kidney disease and been on dialysis for about 15 years. He actually died quite young. And at the end of his life, it was very difficult. He had heart disease and a number of other very complicating problems. As a family, and with his physician, we discussed the end of his life. And we discussed it in a way so that each of us would be able to share with each other about how that would play out. And we did that with his physician. And as a result of that, he ended up writing an advance directive that would be instructive to his physicians if it wasn't his primary physician who happened to be in residence at the time of his death. And as a result of that conversation between the physician and our family and my father, we were able to plan for the end of his life in a way that was respectful to him. In the legislation, there is nothing in the legislation that says we're going to counsel people to death. There is nothing in the legislation that says that you will be required to fill out an advance directive. But there is language in the legislation that encourages physicians to have that conversation with their patients. And I actually happen to agree with that, mostly based on my own personal experience. Let's get a question back in the back.